Well, hello, folks. Today it's controversy. Controversy. Oh my God, the real cause of cancer. What's that about, Adam? Well, we know what the real cause. Well, we don't know. We do know. We don't know. We do know. Well, for a start, let's just get this off the bat. Firstly, what qualifies me to even talk about this? Well, I've worked with thousands of people that had cancer, and I've spoken about this on numerous occasions. I've had family that have had cancer. I've counseled people that had cancer, and I've seen some seemingly miraculous things of people that had cancer. And I've watched a lot of people die from cancer. So let's start there. Thousands of case studies, folks, thousands. I have to say, for legal reasons, this isn't medical advice, and this certainly will go against the grain of anything that you'll hear from any doctor, because they're trained to tell you what to do. They're trained to tell you a certain pathway. And let's just talk about it. Why did I get interested in this? Well, I treated a lot, hundreds at the time, of cancer patients, and my granddad got cancer, and I knew what was going to happen to him. I knew if he went down the medical route, exactly what was going to happen. And as it panned out, that's exactly what did happen, because that's how he chose to get down this route. But it made me look at alternatives. This was about 25 years ago, made me start exploring alternatives. And a couple of years after that, I was trained in energy medicine. I went into all sorts of different techniques, channeling, past life regression, mind body medicine, yoga, meditation, raw food diets, all sorts of things I dabbled with. And not only that, I worked with people that had worked with people that had cancer and got incredible results. So I did a lot of research off my own back on this one, folks. So I do have quite a lot of authority to talk on this, my experience. Now, for those of you that are new to the channel that have just found this, well, who am I? Well, I've given you a bit of my background. And what I'm going to say, you're either going to think it's a load of shit, or you're going to think, well, actually, maybe he's got something to say. What made me interested in this? Well, apart from my granddad getting cancer, one of the things that I had to deal with working on medical wards, and what you have to realize about working on medical wards, they're not like terminal care wards. They're not like hospices where people are trained to deal with cancer. People come in with acute symptoms, and then they find out what's wrong with them. And what happened with me, I had so many people would come in their 40s, sometimes early 50s, with a little bit of pain, only to find out that they had terminal cancer. And they would always ask the same question: is there any hope? Is there any hope? Once the doctors have said there's nothing they could do, is there any hope? So the short version is, folks, for a very tiny percentage, there is, but only a tiny percentage. But you'll need certain things in place if you're to be part of that tiny percentage or to have any chance of being it. So this advice comes with a lot of caveats. If you have been given a terminal diagnosis, then it's not good. But there's definitely hope, folks. It's definitely hope. But that's down to you. It's not anything I'm going to tell you. It's down to you. It's only hope for you if you take total responsibility for your own healing. Let's start with that. I can't heal anyone. I don't heal anyone. I give advice that gives people hope. That's what you'll want. If the day comes, folks, or that day has come where somebody in a senior medical position has said, there's nothing we can do for you, then this is for you, because you've already been given a death sentence and you've got nothing to lose. And it's people that were found themselves in that situation of having nothing to lose that really got me to explore the stuff that I'm going to talk about to you today. So I'm just going to give you an alternative perspective and some case studies of people that I've worked with, that have worked with cancer patients, that have seen seemingly miraculous recoveries. So let's start with that. Let's start with the treatment for cancer, chemotherapy. So chemotherapy is a bit like napalming the forests to get a few Viet Cong during the Vietnam War. Yes, you might kill a few people, the target, but you also kill everything else. Kill the animals, the wildlife, the forestry. It's devastating. And when you get chemotherapy, yes, it will kill the cancer cells, but it also kills all the healthy cells as well. It causes trauma in your body. And the reason that it works for some people is because you realize that this could be the end, and you're going to make the lifestyle choices and the mental choices, which will then heal your body despite the chemotherapy, not because of it, folks. Now, this is critical. You have to realize chemotherapy is a nuclear button for your body. It's nuclear. You kill everything. Well, almost everything. You kill good bacteria as well as bad. You kill a few cancer cells. You kill a lot of stuff that's good that your body needs to function, which is why you can lose your sense of taste. You can lose your hair, folks. Lose your hair. Fancy that. Fancy losing your hair. That would be devastating, wouldn't it? I've never had cancer, folks, just for the record. So the bottom line is that it is a devastating course of action. And the reason that some people pull through when they get medical treatment is because they make the lifestyle changes and the lifestyle choices, which then propel them to a better place. So let's look at it. Now, in my reality, and I've studied this, I've asked every single cancer patient that I worked with once I discovered this. So for probably a 7-year period during my nurse training or my nurse working as a nurse, as a senior nurse in this setting, when people came in with cancer, I used to ask them the question, what's caused you elevated amounts of stress in the last year? Every cancer patient could answer that straight away. Now, I've said exactly the same template for heart disease and strokes. Cardiovascular disease, cancer, it's the same symptoms, folks, same symptoms, same onset of symptoms. Now, our brain, our thoughts, our mind, if we think enough positivity, it manifests into our body. If we think enough negativity, that also manifests in our body. So cancer doesn't happen overnight. It's a period of time. It happens over a period of time. And it comes from repeated thoughts of negative things, of fearing death, of feeling negative towards people, of feeling angry, of feeling depressed, of telling ourselves that we're not good enough. Eventually, these thoughts manifest into our body. So here's a template of things that lead to cancer. Right at the root cause of cancer is your relationship with yourself. Because if you've got a poor relationship with yourself, you'll start telling yourself negative things, which will impact with the domino effect I'm about to highlight for you. If you've got a positive relation with yourself, then the odds are you're never going to get cancer. So there's where to start, folks. And because of the legal situation I find myself in, if this isn't medical advice, I'm going to get you to wear this as a model of the world. It's not reality. Just imagine. Just put this on and wear this. If you've got cancer, wear this, and I bet you resonate with this journey. So if you've got a poor relationship with yourself, the next thing that usually cracks is your relationship with your close family, your mother, father, son, daughter, brother, sister. It's more likely mother, father, brother, sister initially, because that will have been going on longer. And let's face it, if it's son, daughter, then that's probably mainly you that's got to do with that, folks. But that's another story for another day. But there'll be a close family relationship, at least one of them that will break down if you've got a poor relationship with yourself. Now, that doesn't necessarily mean that it won't break down if you've got a good relationship with yourself. It's just a progression that usually happens. It's more likely to happen you've got a bad relationship with yourself. So that will then manifest. It will then manifest to the longer term aspects. So if you've got a bad relationship with yourself, you'll end up in a job that you don't love, or the likelihood is that you're more likely to end up in a job you don't love. And that can lead to daily stress. It's a compounding effect. And some people ended up in a job where they've got the golden handcuffs. They hate the job, but they can't afford to leave. It's like a prison sentence for life, folks. Prison sentence for life, daily stress, cancerous thoughts, negative thoughts spiraling around. And if you've got that, the odds are that you've got a relationship, person that you married, you've fallen out of love. There's friction in the household. Maybe you can't afford to leave. Maybe you're stuck in that daily stress bubble. Stress at home, stress at work, stress every day, negativity every day, compounding over time. This is usually the progression. The advanced medical symptoms of cancer, stuff, the medical things where you know that you're getting way closer to cancer: hypertension, daily stress, your blood pressure going up, thinking negative thoughts all the time, amplifying your blood pressure, making it shoot skyrocket up. The doctors give you some beta blockers or whatever it is, some ACE inhibitors. Let's just call them blood pressure pills. There's lots of different ways that they work. Um, to reduce your blood pressure. Then you lose your motivation, you lose your mojo, because the other side of blood pressure pills is your fight or flight is fucked, folks. You can't get the same fight or flight because you're having all of your responses inhibited because you've got too much stress in your life. And there starts a nasty, nasty cycle. The other medical thing that usually happens that's late in the game is diabetes. Now, it could be argued that diabetes is where you lose the sweetness of life. You lose it. You start to hate the stuff around you. You're lacking in love. You're lacking in love, folks. Now, obviously, there'll be some say, yes, but kids get diabetes. It happens early in life. Or maybe they got fucked up from a younger age, folks. Maybe they just had more of the deck stacked against them from a younger age and their family were more fucked up than usual. So there's also the other side of this, folks. The more messed up that our journey is, the more likely it is you're here for a bigger reason, and the more likely you're watching this channel. So there's a slight flip side in the middle of all this negativity, all these symptoms. And after hypertension, diabetes, these advanced stage medical illnesses, you'll get things like palpitations. Oh, palpitations. It might just come and go, and you'll say, oh, that was weird, and you'll ignore it. Or you might just get little stabbing chest pains where your heart is, like a needle driving in, like instantaneously. And then it goes. You just ignore it. You forget that it happened. Pretend it never happened. That's actually a last stage warning of cancer or a heart attack or a stroke. So it's a final written warning in the bigger picture of things, folks. So these are some of the symptoms. And it all starts in that negative self relationship, negative with other people, probably got a path of people pleasing, probably sucking it up for a long time, probably tolerating way more than you should have done. All of these things compound and cause cancer. They all cause cancer because it's all stressful, folks. Stressful, stress in our lives. So the flip side of that, when some people get diagnosed with cancer, suddenly their life changes. You realize that life's too short for that job that you hate. You're far more likely to leave the job, far more likely to leave the relationship that you're in, and to say, no, enough of this. Or you might go into complete fear and think this relationship's all I've got, and make miserable time for your partner for the rest of your life. Make them feel guilty. That's a frequent flyer too, folks. You've then got the cancer card. You can go around being an arse to everybody and get away with it because you've got the cancer. Oh, they'll make allowances for me when I've got cancer. Brutal but true, folks. Brutal but true. I've seen a lot of people weaponize their cancer and just be arseholes to everyone around them. It's even happened in my family. So I can speak from personal experience and from professional experience of seeing it happen on the wards. So we talked about the symptoms. We talked about what leads to cancer. Let's talk about what you can actually do. Things that you might want to try if all else has failed or they've written you off, folks. So the single most important thing that you can have is a reason to be alive. If you've got a strong reason to be alive, and it might be that you love your kids or you love your partner or you love someone so much or you've got some big purpose to do, that's really helpful. A reason to get out of bed is massive in this equation. Bigger purpose, a suddenly renewed lease of life that you want to live. Now, this might sound obvious, but not everyone has that, folks, when push comes to shove. A real reason to get out of bed. So many people are going through this daily grind of hating their life and just miserably getting up each day. They're prime cancer targets. People with no sense of purpose, no sense of energy, no sense of fun, people who forgot to laugh in their life, people who see life as a prison cell, as a drag, people who are surrounding themselves with negativity and people telling them negative things. This will impact your mental and your physical well-being. It will have a compounded effect. So the things that can work, folks, you've got your purpose. I've worked with people who do raw foods. Your diet can have a profound effect, especially if you move to raw foods. Raw foods. I've spoken to somebody that does that, and they've had phenomenal effects. People that they've worked with. There's also a book called The Journey by a woman called Brandon Bays. If you want a lifetime or a real life story of somebody that had a football-sized tumor in their stomach and healed it themselves, and then created a process for others to follow. Brandon Bay's The Journey. Have a look at that. There's been case after case after case of people that have beaten the odds when they've been diagnosed, as there's nothing we can do. And the one thing that they've all got in common is a belief that it's possible. If you believe the doctors, then you are killing yourself. And one of the most dangerous things you can do is put too much faith in doctors, folks. Now, that's not to say that doctors don't do a good job, but there's something critical that you have to know. If a doctor gives you any hope and you die anyway, the family are more likely to sue. So your nearest and dearest have caused doctors to be cautious and to give you bad news. Here's another thing, because of the placebo effect, because of the power that most of us give doctors, that if a doctor doesn't give you a good diagnosis, you're far more likely to believe it and give up and to write yourself off. So a doctor telling you that you've only got days to live or that you're completely fucked is tantamount to manslaughter in my world because of the authority they have. But in fairness to doctors, if they tell you anything other and you don't pull through, they're going to get sued and they're going to lose their job. So it's nothing against doctors at all. They're doing what they have to do, folks, because of you litigious people that just love to get a few extra quid out of the health service. If your nearest and dearest dies as part of the grieving process, because let's face it, a few extra quid helps the grieving process for a lot of people. Might be a few quid in it, folks. And let's be ruthless. I've seen the very worst of humanity, like vultures hovering around their nearest and dearest when they're facing imminent death. But that's another conversation for another day. The bottom line is, folks, you need a reason to live. You need motivation to try different things. You need a clear purpose. You need to focus on things that you love to do. You need to do your bucket list. You need to tell the people that you love them. And if you really want a case study, you'll look up the work and my interview with Dr. Bernie Siegel on this channel. It is fascinating. Dr. Bernie Siegel, apart from being one of the most in the top 25 of spiritually awakened people alive on this planet, was also a doctor in the 60s, 70s, and he used to operate on cancer. And his life changed one day when one of his patients said, Bernie, what can I do between the operation and the checkup in a month's time? And he didn't really know. He said, look, go out, do your bucket list, live your life, tell people you love them, go walking in nature, buy a pet, walk your dog, do the things that you want to do. And the bottom line was that people that had very short prognosis were still alive 10, 15 years later. And he went on to write a book of miracles and talk about these case studies. He's now the most forefront proponent in mind-body medicine, and he's got a wonderful, wonderful energy about him. I've got 2 interviews on this channel. Look up Dr. Bernie Siegel on this channel, and you'll find those interviews. I've even got a playlist with interviews on it. You'll find one of them there. So have a look at Bernie Siegel if you really want to dive deeper into this from someone who really is a globally renowned expert in the field, folks. You will definitely get an alternative viewpoint on stuff like that. So the bottom line is that if you have no reason to live or to get out of bed, if you haven't got a main mojo motivation and you haven't found it, then you're probably fucked, folks. Which I know is ruthless, and I know it's hard to deal with. But maybe you've just had enough of life and you're ready to die. In which case, the question you're really going to want to know is there life after death? Which is another video for another day. But the quick answer is yes, I believe so. So much so that it's an absolute belief for me. But we can address that on another day, should you wish to. So there's the bottom line, folks. I know this is a controversial subject. And again, look, my perspective flies in the face of anything else that you're going to help. Going to help, you're going to hear. Or not anything else you're going to hear, but a lot of the mainstream stuff, certainly the main stuff that doctors are going to tell you. But bear in mind their legal responsibilities when they're giving you advice as well, folks, as well. So there you go. Hopefully, I've given you some food for thought. Hopefully, I've planted the seed of hope if you are that person that's been given a terminal diagnosis and you're not ready to give up the ghost yet. This could be the message that gives you, that empowers you to do what it needs to reverse that situation. And I'm not going to tell you for certain that you can reverse it because that wouldn't be fair and it wouldn't be realistic. But everybody that has broken with medical advice and has beaten the odds, they believed it was possible. And that is the single most important part of the equation. So, folks, if that exists, there is hope. But if it doesn't, then you may as well just start saying goodbye to everybody else now, because that's the reality of the situation. So, on that uplifting note, absolutely uplifting on this solid topic, which is always fun to discuss, folks, as you'll probably get the gist of me rambling my way through it. It's a very serious subject and will bring a little bit of lightness, hopefully, to you here at the end. But obviously, if you've got any questions, I'll do my best to answer them. If you're going to get litigious on me, you can go and fuck yourself because I've done my caveats. I've put in my little disclaimer there. And the bottom line is, it's up to you. I don't heal anyone. My advice doesn't heal anyone. The people that you work with don't heal anyone. The only person that can heal yourself is you. That's it, folks. That's the bottom line. You're responsible for your well-being and your life ultimately. And if you're prepared to grab the bull by the horns and ride that jumpy journey, then good luck to you. You stand far better chance of pulling through this than anyone else. So there you go, folks. Enough of my little rambles on this very controversial topic. And if you want more of my controversial ramblings and the occasional exercise to help you on your way and a little bit of good advice and a few little interviews, then do subscribe to the channel just there. More of my ramblings there. And whatever situation you find yourselves, folks, all joking aside, I wish you well. I wish you well on your healing journey because nobody can do more for you than you can do for yourself right now.